A very important MCQ, बच्चों, very important MCQ. Any other joint in which an articular disc is present, this also comes in MCQ. So type 1 collagen fiber, where do we get? We get in tendons, we get in bone, we get in skin. So बस ये याद रखना, the terminal part of IBC is known as the hepatocardiac channel. So axillary nerve supplies 3 things. ये याद रखना बच्चों. Axillary nerve क्या supply करता है? Deltoid. It supplies the teres minor and it gives a cutaneous branch. Who is this lying on the uncinate process? On the uncinate process. So a crisp session है ये, and I've tried to incorporate the maximum MCQs. During discussion, we'll be discussing the options also, so you'll get an overall idea about the subject, about the MCQs. But just be interactive, बच्चों, interactive रहो, so it will be easy for you. Hello Kshitij, so it will be easy for you also, and it will be easy to understand also. Starting with the first MCQ, bachcho, have a look at this MCQ. A medical student during his viva was describing the scapula. It has 3 angles, 3 borders, 2 surfaces. Yes, we are discussing now 2 surfaces and 3 processes: spine, acromion, and coracoid process. Of this processes, coracoid process is an example of dash epiphysis. Yes, what is the answer that you have written? Coracoid process of scapula is an example of atavistic type of epiphysis. Atavistic. Now bachcho, what is a diaphysis? Now let me just talk, let me discuss, and you interact. So many things will be covered. So what is a diaphysis, bachcha? What is a diaphysis? So diaphysis wo hota hai, that's the part of the bone which develops from a primary center of ossification. Correct? The part of the bone which develops from a primary. So bachcho, what is traction epiphysis? Pressure epiphysis clear hai. So what is traction epiphysis? The epiphysis formed due to pull of the muscles. That is traction of the muscles, and that is what we call as traction epiphysis. Example bol sakte ho bachcho? Can anyone tell me example of traction epiphysis? The elevations that we get on the bone, all the elevations. What is that? Tubercles of humerus, trochanters of femur, tubercles of humerus, trochanters of femur. ठीक है ना? Then mastoid process, tibial tuberosity. See, ये जितने भी elevations है, all these elevations on the bone are formed due to pull of the muscles. This is what we call as traction epiphysis. Perfect है? Tubercles, trochanters, mastoid process, tibial tuberosity. Perfect. Now, what is atavistic epiphysis? Atavistic epiphysis वो होता है which is functional in lower animals. Yes, this is functional in lower animals and it is degenerated in humans. It has lost its importance. It's a separate bone in lower animals, and as evolution has occurred, this has lost its importance. It has got attached to some other bone. Example, coracoid process of scapula. Example is coracoid process of scapula. Anything else? Anything else? So example is acromion nahi bacha, acromion nahi. It's the coracoid process of scapula. Coracoid process of scapula. Then there is something known as os trigonum of talus. Os trigonum of talus. This is an example of what? Atavistic epiphysis. अब ये clear है बच्चा? What is atavistic epiphysis? Epiphysis which is functional in lower animals. It is degenerated in humans. It has lost its importance. It is degenerated in humans. Example is coracoid process of scapula and os trigonum of talus. Perfect hai? Come to the last epiphysis. Extra epiphysis hota hai, an additional epiphysis. What we call this as aberrant epiphysis. So what is aberrant? It's an extra epiphysis. Extra. Example bol sakte ho? Example of extra epiphysis, example of aberrant epiphysis. Bachcho, can anyone tell me this? Come on, be interactive, be interactive. Jitna interactive rahoge, I can tell you more and more and more. Okay. Bolo bachcho. Example of an extra epiphysis, aberrant epiphysis. It's the proximal end of first metacarpal bone. Proximal end of the first metacarpal bone. ठीक है? So proximal end of the first metacarpal bone, there's an additional epiphysis and we call this as aberrant epiphysis. Perfect है बच्चों? Is this clear to all of you? So just remember the examples, you get MCQs on these types of epiphysis. Are you able to follow this? Bolo bacho, if it's clear, just put a thumbs up. So I know, Cheryl Kumar. Okay, fine. I'm looking at the screen. तो जो भी आपके comments है, I'm able to see those comments. ठीक है? अगर कुछ भी नहीं समझता, if you're not able to follow anything in between, just ask me. Just ask me. Okay, fine, perfect, bacho. Coming to the next MCQ. Okay, so coming to the next MCQ. Which of the following regarding bones? Hello, Kishore. Which of the following regarding bones is false? Yes. What is the answer for this? Which of the following regarding bones is false? Anyone? What have you written this as the answer? Yes. Which of the following statement? Yes. Very good. So bone contains type 2 collagen fibers. This is wrong. What is the type of collagen fiber? Collagen number 1. Type 1 collagen fiber is present in bones. Okay, let us understand the types of collagen fibers. Just remember this. This also comes in MCQ. So type 1 collagen fiber, where do we get? We get in tendons, we get in bone, we get in skin. Type 1 collagen fiber. Type 2 collagen fiber is found in cartilage. Type 3 is found in reticular fibers. Type 4 collagen is found in basement membrane, and type 5 collagen is found in hair, placenta, blood vessels. Okay, so bone contains which type of collagen? Type 1. Now, bacho, can anyone tell me what are the cells that we get in the bone? There are 4 types of cells that we get in the bone. Can anyone tell me this? 4 types of cells which are present in the bone. One is an osteoprogenitor cell. Osteoprogenitor cell. Now, what does this osteoprogenitor cell do? It is going to form the osteoblast. And this is a parent cell. So what is this going to do? This is going to form the osteoblast. The second cell that we find in the bone is, yes, second cell we find in the bone is osteoblast. So osteoblast ka function kya? It forms this bone, it forms the matrix of the bone. Once this function is done by the osteoblast, what does it become? Osteoclast. Yes. Osteoclast is a resting osteoblast. Osteoblast ka function ho gaya. When it is resting, we call it as osteoclast. Osteoblast, osteocyte. Sorry. And what is an osteoclast? What is the function of an osteoclast? Osteoclast ka function kya hai? It removes the dead matter. So this helps in phagocytosis. Phagocytosis say it removes the dead matter. Osteoblast produces collagen, produces the extracellular matrix, produces the bone. Osteoblast, when it is resting, it is known as osteocyte. And tisra is osteoclast. What is the function of osteoclast? It removes the dead material by phagocytosis. Okay? So these are the 4 cells that we find in the bones. Can anyone tell me what are the 2 types of ossification? Bol sakte ho? How is the bone formed? There are 2 ways of bone formation. Can anyone tell me what are the 2 types of ossification? Bol sakte ho bachcho? Bolo. एक जिसमें what happens is there's a model of cartilage. एक cartilage का model होता है which is converted into a bone, and one is a membrane which is converted into a bone. So what is this ossification known as? Membranous. When a membrane is converted into a bone, that is known as a membranous ossification. And when there's a cartilage model and this cartilage model is converted into a bone, what do we call this as? Endochondral. Bacha, it is endochondral. Endochondral ossification. So there are 2 different types of ossification. One is endochondral. Subchondral jo bol rahe ho na Naman, that is endochondral ossification, जिसमें एक cartilage model होता है and this cartilage model is converted into a bone, right? Generally all long bones. Membranous ossification, in which a membrane is formed and this membrane is then converted into a bone. Like clavicle, we say no, it is membranous clavicle, like that. Yes, very good, very good. Akhand, very good. So see the options now. Osteocytes are the major cell types in mature bone. Yes, collagen is synthesized by osteoblast. Calcium phosphate is the major inorganic material. Yes, fine. So answer is A for this, bacho. Answer is A for this. Perfect. Very good. Very good. So coming to the third MCQ. Coming to the third MCQ, have a look at this. Intra-articular disc is made up of fibrocartilage. बराबर है? Intra-articular disc is made up of fibrocartilage, divides the joint into compartments, making it a complex structure. Which of the following joint contains an intra-articular disc? बोलिए. Out of all these joints, which of this joint contains an intra-articular disc? Yes, बच्चों. Yes, very good, very good, very good, Naman. It's the sternoclavicular joint. Sternoclavicular joint में articular disc होता है. Any other joint in which articular disc is present? Can you answer this, बच्चों? Any other joint जिसमें articular disc होता है? Answer this. A very important MCQ, बच्चों. Very, very important MCQ. Any other joint in which an articular disc is present? Come on. You can guess, huh, बच्चों? You can guess. Mistakes करो. Make mistakes here. I'm here to correct you. That's fine. Any other joints in which articular disc is present? Come on, guess, बच्चा. Come on. हाँ, एक होता है wrist joint. Wrist joint. Wrist joint में articular disc होता है. Knee joint में नहीं. Knee joint में meniscus होता है बच्चा. Meniscus. The third is temporomandibular joint. Articular disc is present in three joints: sternoclavicular joint, wrist joint, and temporomandibular joint. Temporomandibular joint. And this articular disc is what type of cartilage? It's a fibrocartilage. Fibrocartilage. Okay. Now I'll just tell you this. Cartilage is sort of three types, right? One is hyaline cartilage. Second is second is elastic cartilage. And third is fibrocartilage. चलो बच्चों, tell me, where do examples of hyaline cartilage? Can anyone tell me this examples of hyaline cartilage? ये सब MCQs आते हैं बच्चों, याद रखना. Nasal septum, thyroid, cricoid. Okay, nasal septum, thyroid, cricoid. These are all examples of hyaline cartilage. Examples of elastic cartilage. बच्चों, answer this. Example of elastic cartilage is pinna, epiglottis. जितना हो सकता है ना उतना आई एम ट्राइंग टू टेल यू. हाँ, जितना मैक्सिमम हो सकता है आई एम ट्राइंग टू टेल यू. पिन्ना, epiglottis, these are all examples of elastic cartilage. White fibrocartilage, example is articular disc. Articular disc, menisci, intervertebral disc. These are examples of white fibrocartilage. Yes, bacha, yes. Ligamentum flavum भी fine. Yes, white fibrocartilage. ठीक है. Articular disc, menisci, intervertebral disc. These are examples of white fibrocartilage. Now we have got three types of cartilage: hyaline cartilage, elastic cartilage, and white fibrocartilage. Can anyone tell me largest size of chondrocytes? सबसे बड़े chondrocytes. Largest size of chondrocytes are found in which of these three cartilages? Come on. Largest size of chondrocytes are found in which of these three? Answer this. That's very important. Very important. बोल सकते हो बच्चों? Largest size of chondrocytes are found in. ये सब MCQs हैं. Whatever I'm talking, whatever I'm telling you are all MCQs. याद रखना. Hyaline है, elastic है, white fibro. In this, largest size of chondrocytes are found in elastic cartilage. याद रखना बच्चा, largest size of chondrocytes are found in elastic cartilage. Remember this. And perichondrium is absent in which of this cartilage? Perichondrium क्या होता है? It's the covering of cartilage, correct? So perichondrium is present in hyaline cartilage. Perichondrium is present in elastic cartilage. Perichondrium is absent in white fibrocartilage. Yes, perichondrium is absent. ये याद रखना बच्चों. This is very important. So this comes as an option in the MCQ, right? So perichondrium is absent in white fibrocartilage, hyaline cartilage, elastic cartilage में perichondrium is present, correct? And we have discussed the sites where these cartilages are found. Perfect. Now you tell me, what is articular cartilage? Articular cartilage. And what is articular disc? ये ना, इसमें बहुत confusion होता है. In this, there's always confusion. बच्चे are always confused in articular cartilage and articular disc. Can anyone tell me what is this two? कुछ difference है बच्चों? Is there any difference in this two? Articular cartilage and articular disc. कुछ difference है? चलो guess बच्चों, guess. Even if it is wrong, it's okay बच्चा, but be interactive. Come on. The more you interact, the more I'll be able to tell you all. हाँ, answer बच्चों. Articular cartilage is hyaline. Yes, very good बच्चा. Articular cartilage is hyaline. That's excellent. Akhand. So articular cartilage is an example of hyaline cartilage. Articular cartilage क्या होता है बच्चा? Which lines the surfaces of the bones which takes part in the formation of joints, है ना? Like these are the two bones which are forming the joint. So the surfaces of these bones are covered by hyaline cartilage, and that is articular cartilage. Whereas articular disc is fibrocartilage. समझ में आया ये? There's no confusion. Articular cartilage is hyaline, ये याद रखना, and articular disc is white fibrocartilage. Perfect है, no confusion. तो ये सब MCQs आते हैं on this topic. So I've finished this. Okay. Students are always confused in articular cartilage, articular disc. So I made it clear to you. Perfect है बच्चा. चलो. Tell me shoulder joint. What is the type of joint? Shoulder joint. Type of joint बोल सकते हो बच्चा? Type of joint. Shoulder joint. Yes, it's a ball and socket. Yes, ball and socket. Elbow joint is a hinge joint. Hinge type of joint. Ankle joint is hinge. Hinge joint. Sternoclavicular joint. Type बोल सकते हो? Sternoclavicular joint. What is the type of joint? Anyone? Sternoclavicular joint is a saddle type of synovial joint. Saddle type of synovial joint. So shoulder joint is ball and socket. Elbow joint is hinge. Ankle joint is hinge type of synovial joint. Sternoclavicular joint is a saddle type of synovial joint. And acromioclavicular बोल सकते हो? Acromioclavicular joint. What is this type of joint बच्चा बोल सकते हो? Acromioclavicular joint. What is the type of joint? Come on, बच्चों बोलो. Answer. Acromioclavicular joint is a plain synovial. ये याद रखना. Plain synovial joint. ठीक है? And ये plain synovial joint में what movements are seen? Only gliding movements. बच्चों, gliding movements are seen. Gliding movements. Plain synovial joint, example is acromioclavicular joint. And what are the movements seen in this? Gliding movements. Clear? Plain synovial joint. Like you see, intercarpal joints, the joint between the carpal bones, the joint between the tarsal bones, these are plain synovial joint. Isme there is only gliding movements which takes place. Perfect. Chalo, I hope this is clear to all of you, bacha. Clear to all of you? Let us proceed. Okay, sure. So what are important things which are there? I've told you. Come on, students, come on. Let us answer this MCQ. While approaching the axilla, the surgeon reflects the pectoralis major to find a fascia deep to it. Like the moment you reflect the pectoralis major, what is the fascia deep to the pectoralis major? That's the clavipectoral fascia. Following structures pierce the clavipectoral fascia except. Answer this. Answer this question. B. Medial pectoral nerve. Very good. Medial pectoral nerve. So what is clavipectoral fascia? Clavipectoral fascia lies deep to the pectoralis major. And what are the structures piercing the clavipectoral fascia? One is the cephalic vein, the thoracoacromial artery, the lateral pectoral nerve, and fourth is lymphatics from the breast. Lymphatics from the breast. Correct? So, who does not pierce the clavipectoral fascia? The medial pectoral nerve. Can anyone tell me what is the medial pectoral nerve pierce? Answer this. What is the medial pectoral nerve pierce? Bolo bachcho. Medial pectoral nerve does not pierce the clavipectoral fascia. What is the medial pectoral nerve pierce? Indirectly, वो clavipectoral fascia को भी pierce करता है, but it pierces something. It pierces some muscle. Come on. Answer this, bachcho. The medial pectoral nerve is going to pierce what? It pierces the pectoralis minor. It pierces the pectoralis minor. याद रखना है, it pierces the pectoralis minor. So I'll just draw the clavipectoral fascia for you. Have a look. This is the clavicle here, clavicle. This clavipectoral fascia. Okay, that's fine, बच्चों. That's fine. I'm here to tell you. I'm just asking. अगर पता है तो बोलो, नहीं पता है तो that's okay, बच्चों. I'm here to tell you. So medial pectoral nerve क्या pierce करता है? Pectoralis minor. Remember this, huh? Another very important MCQ. Who pierces the pectoralis minor? Medial pectoral nerve. So this is the clavicle, huh? Clavicle, okay. And this clavicle से what begins is the clavipectoral fascia. The clavipectoral fascia begins from the clavicle, comes down. यहाँ पे एक muscle होता है. There's a muscle below the clavicle. The fascia encloses this muscle. What is this muscle? This is the subclavius. This is the subclavius. Now this fascia goes down, encloses another muscle. ये कौन है? Can anyone tell me? This is the pectoralis minor. Pectoralis minor. And now this fascia is inserted into the axilla. It is then inserted into the axilla. So what are the muscles which the clavipectoral fascia is going to enclose? Number one is the subclavius muscle. Number two is the pectoralis minor. Now this part of the fascia between the pectoralis minor and the axilla is known as suspensory ligament of axilla. This is known as the suspensory ligament of axilla. अब इसके बाहर क्या होता है? What is this muscle outside this? This is the pectoralis major. That's the pectoralis major. So what is the medial pectoral nerve doing? The medial pectoral nerve is going to pierce the pectoralis minor and then it goes and supplies the major. The lateral pectoral nerve pierces the clavipectoral fascia and pierces the pectoralis major. Fine? Is this clear, bachcho? Is this clear to all of you? Okay. Fine. So can anyone tell me what is this thoracoacromial artery? Chalo bachcho bolo. Thoracoacromial artery is a branch of what? This thoracoacromial artery is a branch of. Anyone answer this? Your attempt, always try bachcho. Even if it is wrong, it's okay. यहाँ पे mistakes करो. In fact, I'm here to correct you. Finals में mistakes नहीं करना अपने को, है ना? तो जितना कर सकते हो mistake यहाँ पे कर लो. Thoracoacromial artery is a branch of what? And जब गलती करोगे, when you make a mistake, you will always remember it. ये याद रखना. हाँ बच्चों बोलो. Thoracoacromial artery is a branch of. Anyone? कोई बोल सकता है? Thoracoacromial artery is a branch of second part of axillary artery. It's a branch of second part of axillary artery. ये याद रखना. वैसे axillary artery is divided into 3 parts. You know this axillary artery के 3 parts होते हैं. I'll just make it here. So this is the first rib. This is the first rib. And what is this artery here? That's the axillary artery here. That's the axillary artery. What is this muscle here, bachcho? One moment. What is this muscle here? This is the pectoralis minor. Pectoralis minor. So this is the axillary artery, and this axillary artery is divided into 3 parts. So from the outer border of the first rib to the muscle, what is this part of the axillary artery? First part. Muscle के पीछे क्या होता है? Second part. And what is this part? That's the third part of the axillary artery. The axillary artery is divided into 3 parts by what? Pectoralis minor. Now what are the branches of axillary artery? Yes, very good, excellent. Branches of axillary artery you should know, huh? You must know it. You should know. So simple. First part, 1 branch. Second part, 2 branches. And third part gives 3 branches. So which is the branch from the first part? First part ki branch is superior thoracic artery. First part, 1 branch, superior thoracic artery. Second part, 2 branches. One is lateral thoracic artery and the second one is thoracoacromial artery. So lateral thoracic and thoracoacromial. And third part ke 3 branches. 3 branches. 1, anterior circumflex humeral. Second, posterior circumflex humeral. And the third branch is subscapular artery. Subscapular artery. ये याद रखना बच्चों. Okay, first part superior thoracic. Second part के दो branches, lateral thoracic, thoracoacromial. Third part, three branches, anterior circumflex humeral, they wind around the humerus, anterior circumflex humeral, posterior circumflex humeral, and the subscapular artery. बस perfect है, ये याद रखना है आपको. You have to remember this. Okay, my dear children, tell me, this cephalic vein drains into what? The cephalic vein opens into axillary vein. Cephalic vein is present on which side? Lateral side. है ना? Lateral side of upper limb पे what is the vein there? Cephalic vein. Medial side पे एक vein होती है. Medial side of upper limb there's a vein. कोई बोल सकता है? Can anyone answer this? What is the vein on the medial aspect of the upper limb? Yes. बोलो बच्चों. What is the vein on the medial aspect of the upper limb? समझ में आ रहा है? Lateral side पे कौन है? Cephalic vein है. Which is the vein on the medial aspect of the upper limb? That's a basilic vein. Basilic vein. And what is the vein which connects the cephalic and the basilic vein? Here in the roof of cubital fossa, that's the median cubital vein. Very good, Akhand. So medial side पे the vein is basilic, ठीक है? Lateral side पे the vein is cephalic vein, and the vein which connects the cephalic and the basilic vein is median cubital vein, and this median cubital vein is present in the roof of cubital fossa, जिसमें we give intravenous injections. Yes, very good. Perfect है बच्चा. Perfect है. This question is clear, my dear children. Fine. So we'll go to the next MCQ. Coming to the next MCQ, a 19-year-old male meets with a vehicular accident. X-ray shows fracture of the surgical neck of the humerus. So, which is the nerve which winds around the surgical neck? You have to know this. The nerve which winds around the surgical neck of the humerus is axillary nerve. So, जब surgical neck of humerus is fractured, which is the nerve injured? Axillary nerve. All the followings will be seen except. Okay. So, can anyone first tell me what is the axillary nerve supply? मतलब axillary nerve is injured. So, what is the axillary nerve supply? I'll just write it down. Axillary nerve supplies two muscles. One, deltoid. Second, teres minor. Axillary nerve supplies two muscles. ये है axillary nerve. Fine, very good. आंसर क्या लिखा आपने? लॉस ऑफ ओवरहेड एब्डक्शन. परफेक्ट है माय डियर चिल्ड्रन. परफेक्ट. वेरी गुड. सो नाउ लेट अस डिस्कस दिस एमसीक्यू. Surgical neck fractured है. Okay. Which is the nerve which winds around the surgical neck? Axillary nerve. Perfect. अब what is the axillary nerve supply? Can you tell me? Axillary nerve supplies two muscles. One is deltoid. Second one is teres minor. And it gives a cutaneous branch. Can anyone tell me the cutaneous branch? That is known as the upper lateral cutaneous nerve of arm. So axillary nerve supplies three things. ये याद रखना बच्चों. Axillary nerve क्या supply करता है? Deltoid. It supplies the teres minor and it gives a cutaneous branch. ये cutaneous branch है. See, what is this aspect of the arm? Lateral aspect है ना. ये क्या है बच्चों? Lateral aspect. We divide this into two half. Upper half, lower half. So this upper lateral aspect of the arm, this skin is supplied by whom? Axillary nerve. ये skin को कौन supply करता है? Axillary nerve. Yes, very good. And if there's a damage to this axillary nerve, there's a loss of sensations here on the upper lateral aspect of the arm. You've seen army people, they put a badge here. उसको क्या बोलोगे आप? Regiment badge. So if there is damage to the axillary nerve, there's a loss of sensations here on the upper lateral aspect of the arm, and this is what we call as regiment badge sign. Regiment badge है ये BADGE. Very good बच्चा. Very good. Yes, Shail Kumari, very good bacha. Naman, yes. So, okay, fine. Now you tell me what is the action of deltoid. Can anyone tell me action of deltoid क्या? Deltoid does abduction, है ना? Deltoid का main action is abduction, but not the entire abduction. 0 to 15 degrees of abduction कौन करता है? Answer this. 0 to 15 degrees of abduction is done by whom? Anyone answer this? 0 to 15 degrees of abduction is done by supraspinatus. 15 degree tak supraspinatus. 15 to 90 is done by whom? Deltoid. 15 to 90 degrees done by deltoid. And who does this overhead abduction of arm? Can anyone answer this? So 0 to 15 degrees supraspinatus, 15 to 90 degrees deltoid, and 90 and above we call this as overhead abduction of arm, and this is done by two muscles. One is the trapezius and second is the serratus anterior. याद रखना बच्चा ये serratus anterior and trapezius. Very good, excellent, very nice. You are answering very well. Yes. So deltoid does what? Abduction from 15 to 90 degrees. बराबर बच्चों? So if deltoid is paralyzed, abduction would be lost from 15 to 90. इतना abduction would be lost. Okay. What is the action of teres minor? It is the lateral rotation. Action of teres minor is lateral rotation of shoulder joint. So बच्चों, if teres minor is damaged, there will be loss of lateral rotation. Lateral rotation would be lost. So see, listen. एक मिनट. Hello. Listen. Axillary nerve, if it is injured, axillary nerve injury हो गया, two muscles will be paralyzed, deltoid, teres minor. So which actions would be lost? 15 to 90 degrees of abduction would be lost. Lateral rotation would be lost. And sensations कौन से जाएंगे? Which sensations would be lost? Upper lateral aspect of the arm, and this is what we call as regimen batch sign. Very important. Which is the nerve which winds around the surgical neck of humerus? Axillary nerve. देखो एक MCQ में there are many hidden MCQs. So try to understand बच्चों जितना whatever maximum I can tell you, I'm trying to tell. Right? Just be with me. Okay. So tell me. This shape of the shoulder, बच्चों, this shape of the shoulder is known as what? Contour. है ना? This is the contour of the shoulder. And this contour, this shape of the shoulder is because of what? Deltoid. If the deltoid is paralyzed, the shape of the shoulder is lost, and this is what we call as flat shoulder. So loss of rounded contour of shoulder, yes, that is what we call as flat shoulder. And when do you get? In paralysis of deltoid, correct? Yes. Atrophy, yes, when a muscle is paralyzed, we get atrophy, correct. Loss of sensation on the upper lateral aspect of the arm is correct. So all the following will be seen except your answer is loss of overhead abduction. Overhead abduction is done by serratus anterior and trapezius. Perfect. बच्चों कुछ doubts है इसमें तो बोलो. If there's any doubt in this, you tell me. Now, coming to the next MCQ. ये सब important MCQs हैं बच्चा. Whatever I put here now are all important MCQs. Come on, see the next MCQ. A female with breast cancer comes to the OPD with complaint of pitted-like skin changes in the affected breast near the areola. Her doctor tells her that this change is known as P-due orange appearance. He asked the students about the exact cause of this appearance. The best possible answer would be subdermal lymphatic blockage. Okay, excellent. Very good to all of you. Can anyone tell me involvement of, involvement of cutaneous lymphatics in cancer of the breast. Involvement of cutaneous lymphatics in cancer of the breast leads to P-due orange appearance. Okay, that's fine. Involvement of lactiferous ducts. Answer this. In CA of the breast. What happens here? Involvement of lactiferous ducts leads to what? And involvement of Cooper's ligament leads to what? बोलो बच्चों, चलो. Involvement of cutaneous lymphatics. Cutaneous lymphatics block होते हैं. If there's a blockage of the cutaneous lymphatics, what do we get? P-due orange appearance. Perfect. If there's involvement of lactiferous ducts, what happens? in cancer, involvement of lactiferous lung leads to retraction of nipple. Retraction of the nipple is pulled inside, and involvement of Cooper's ligament leads to puckering or dimpling of the skin over the breast. Very good. ये याद रखना. Some very important things. Excellent. Very good. ठीक है ना, ये सब समझ में आया. In cancer of the breast, 3 things are involved: cutaneous lymphatics, the lactiferous ducts, and the Cooper's ligament. So Cooper's ligament involvement leads to a puckering of the skin over the breast. My dear children, can anyone tell me what is the main artery? What is the chief artery supplying the breast? That was an MCQ asked. बोल सकते हो? Which is the main artery supplying the breast? Answer this. वैसे बहुत सारे arteries है. There are plenty of arteries. Out of this, which is the main artery supplying the breast? And this artery is therefore enlarged in females. Answer. Answer this. You can guess. Guess karo bacha. Now if you make a mistake, no, you'll always remember this. Internal thoracic nahi hai bacha. Internal thoracic nahi hai. No. No, it's not internal thoracic. Anyone else? So internal thoracic is one of the arteries supplying the breast. Yes. Anterior intercostal arteries hai, posterior intercostal arteries hai, superior thoracic artery hai, acromiothoracic artery hai, and lateral thoracic artery hai. So these are the arteries which supply the breast. Out of all this, my dear children, there's one artery which is very, very, very important, and that is lateral thoracic artery. Just remember this: lateral thoracic artery. So the chief artery supplying the breast is lateral thoracic. You'll remember this now. So this artery is enlarged in females. This artery is enlarged in females. Lateral thoracic artery. वैसे there are plenty of arteries, but the main artery is lateral thoracic, and this lateral thoracic artery is a branch of second part of axillary artery. Second part of axillary artery. We just discussed that. Yeah. Okay, fine. याद रखना बच्चा ये सब. ठीक है. So that is involvement of Cooper's ligament and all. So answer is D for this. I've told you. Coming to the next MCQ, बच्चों. Answer this. An injury to the shown area can lead to fracture of which bone? So what is this structure which is shown here? Answer this first. ये क्या structure है? What is this area which is pointed here? Answer this, children. What is the area which is pointed here? Answer is B, scaphoid. Scaphoid is answer. Yes. What is this area, my dear children? Bolo, what is this area? This is the anatomical snuff box. This is the anatomical snuff box. Can anyone tell me the boundaries of the snuff box, bachcho? Boundaries of the snuff box, koi bol sakta hai? See, I'll make a slide for you. Ye yaad rakna. Just remember this slide. Look how beautiful slide I make. That's the head of the radius. That's the neck of the radius. That's the radial tuberosity. And children, this radial tuberosity is what type of epiphysis? Again, traction epiphysis. So that's the radius. That's the styloid process of the radius. That's the ulna. That's the styloid process of the ulna. Now you're looking from backside. पीछे से देख रहे हो. You're looking from backside. What is this muscle, students? Yes, very good. You're answering. Cherry Kumari? Yeah. What is this muscle which begins from both radius and ulna? Muscle which begins from both radius and ulna is abductor pollicis longus. Muscle which begins from the radius is extensor pollicis brevis. देखो कैसे याद रखने का. Just I'm giving you a very easy way to remember the snuff box. Snuff box पे you get MCQs. Okay. So abductor pollicis longus. This is extensor pollicis brevis. They go together. So abductor pollicis longus and extensor pollicis brevis, they go together. They form the lateral boundary of the snuff box. Lateral boundary. Now, what is this muscle? This is the extensor pollicis longus, and this extensor pollicis longus is going to form the medial boundary. ये समझ रहे हो? So this is going to form the medial boundary of the snuff box, and this is going to form which boundary? This too is going to form the lateral boundary of the snuff box. Perfect. The floor of the snuff box is formed by styloid process of radius, scaphoid and trapezium. Scaphoid, trapezium, and this is styloid process. So if there's a fracture, if there's an injury to the snuff box, which is the bone fractured, scaphoid. Because scaphoid lies in the floor, hai na bacha? So what lies in the floor? The styloid process of radius, the scaphoid bone and the trapezium bone. Trapezium. What is the content of the snuff box? Who lies in the snuff box? Bol sakte ho? Anyone answer this? What is the content of the snuff box? Come on, bacho. Come on. Come on. Come on. Come on. Be quick. Answer. Who lies in the snuff box? Any guesses? Any guesses? Content of the snuff box is radial artery. Very good. Kshitish, very good. And who lies in the roof? In the roof lies the cephalic vein and superficial branch of radial nerve. Superficial branch of radial nerve. Superficial branch of bacha, radial nerve nahi. Remember, Akhand, it's not radial nerve, it's the superficial branch of radial nerve. Because apna radial nerve divides in the cubital fossa. Our radial nerve divides in the cubital fossa into a superficial branch and a deep branch. The deep branch of radial nerve is known as the posterior interosseous nerve. So which is the nerve which goes like this? Superficial branch of radial nerve. Superficial branch. है ना? Perfect है ये? Snuff box clear है? Will you be able to answer the MCQs on the boundaries of the snuff box, बच्चों? Lateral boundary is formed by abductor pollicis longus, extensor pollicis brevis. The medial boundary is formed by extensor pollicis longus. The floor is formed by the styloid process, the scaphoid, the lunate. Scaphoid and trapezium, I'm so sorry. The styloid process, scaphoid and trapezium. Who's the content? Radial artery, and roof में कौन है? Cephalic vein and the superficial branch of radial nerve. That's how you should revise. Perfect. Coming to this, MCQ number 8. Come on. MCQ number 8. A patient presented with history of chop injury to the right hand is undergoing surgical repairs. Okay, take an injury, there's an injury and the person is undergoing repair. It is observed that the patient is unable to completely fold. Sorry, one moment. It is observed that the patient is unable to fold the ring finger. Completely fold the ring finger while making the fist as shown in the diagram. Okay, so the person is not able to fold the ring finger. So which structure injury results in this deformity? Follow. Now which is the muscle which enters into the fingers, which does flexion of the fingers? Anyone? Answer. Haan bacha, wait, I'm telling you, no, Naman, wait, no, Naman, I'm telling you, it's the flexor digitorum profundus. Flexor digitorum profundus. Dekho bacho, huh? Now let answer this, Naman, understand this. Okay, look, this is the finger. Huh? ये मैंने एक finger draw किया. I've drawn this as a finger. ये distal phalanx है, ये middle phalanx है, and ये proximal phalanx है ना, 3 phalanges है ना fingers को. Now, students, can you tell me what is this tendon? Huh? This is a tendon which comes here, which divides into 2 like this, and which goes and gets inserted here into the middle phalanx. This muscle goes and gets inserted into the base of middle phalanx. Sorry, what happens here? It goes and gets inserted into the base of middle phalanx, and this is the tendon of flexor digitorum superficialis. And there's a muscle which is deep to the superficialis. Okay. हाँ बच्चा, 4 fingers को supply करता है, thumb को नहीं supply करता. Thumb को, it doesn't go to the thumb, it goes to the 4 fingers. तो ring finger पूछा ना, ring finger पूछा ना बच्चा. And what is this muscle which is lying deep to the superficialis? It goes and gets inserted into the base of distal phalanx. Who's this? This is the flexor digitorum profundus. Okay, tell me students, which is the muscle which is going to flex the distal phalanx of the fingers? Answer this. Which muscle is going to flex the distal phalanges of the fingers? Answer. Answer. Which muscle is going to flex the distal phalanx of the finger? They say all of them will be extended. All of them will be extended. What you're saying is right, but they have focused on one finger. That is just to confuse you, Naman. All the fingers will be extended because flexor digitorum profundus goes to all the fingers, no? So all the fingers, there will be extension. Fine. But they are just focused on one finger, that is ring finger. That's fine. That's fine. All the fingers will be extended. Your question is right. Right. You're right. Fine. So answer is flexor digitorum profundus. Yeah. Now tell me, flexor pollicis longus, where does it go? To the thumb. Hai na? Flexor pollicis longus goes to the thumb. Medial nerve. Okay, fine. The answer is flexor digitorum profundus. Can anyone tell me the nerve supply? That's okay, Namal. I can understand. So flexor digitorum profundus का nerve supply बोल सकते हो. Who supplies the medial half? And who supplies the lateral half? Answer this, बच्चों. Flexor digitorum profundus का nerve supply want. Come on, my dear children, come on. Be active. Who supplies the medial half of profundus? Who supplies the lateral half of profundus? So medial half of profundus and lateral half. Medial half is supplied by whom? Ulnar nerve. And the lateral half is supplied by a branch of median nerve. A branch of median nerve, and that is known as the anterior intraosseous nerve. Anterior intraosseous nerve. Median hai bacha, but specifically it's a branch of median nerve. Name is anterior intraosseous nerve. Clear? Just to confuse you, this question is given like this. What Naman has asked is perfect. Profundus injury ho gaya, so all four fingers should be extended. That's fine, but they are focused only on ring finger. But out of all this, answer is profundus. Okay, so your confusion can be solved by that. Very good, very good. Okay, coming to the next MCQ. Identify the pointed structure. Chalo bolo bachcho, what is this? Hello, hello, answer. My dear children, answer. Identify the pointed structure. Bolo, bolo. Interesting hai na MCQs? Yes, are you getting interest? Bolo. Yeah, na. What is this structure? Musculocutaneous nerve. Perfect, excellent, very good to all of you. You're very nice, very good. अभी है ना, let us identify the rest of them also. ये ना क्या बोलते हैं इसको, image based slides are very important. You have to know this. Identify this muscle. बच्चों, what is this muscle? Can anyone tell me what is this muscle and what is this muscle? What is A? What is B? Answer this. What is A? A is biceps. What is B? Brachialis, है ना? B is brachialis. A biceps है, B brachialis है, and between the biceps and the brachialis, what do we have? The musculocutaneous nerve. X. Very good. That's a musculocutaneous nerve. Naman, what is this nerve? Can anyone tell me, bacha, what is this nerve? Anyone? Where are we? Where are we? We are in the cubital fossa, my dear children. Up in cubital fossa mein hai na. So what is this structure? That's a median nerve. What's this? That's the brachial artery. What's this? That's a tendon of biceps. And ye kaun hai? Radial nerve. So we are in the cubital fossa, and you know the boundaries of cubital fossa, correct? हाँ ठीक है ना, ठीक है बच्चा, यू मेक मिस्टेक्स, यहाँ पे मिस्टेक्स करो तो अभी है ना, नाउ यू गेट एन आइडिया, तो बाद में यू नॉट मेक मिस्टेक्स, ठीक है बच्चा. सो दिस इज द बाइसेप्स. Okay, so right, so this is the median nerve, that's the brachial artery, sorry, that's the median nerve, that's the brachial artery, that's the tendon of biceps, and that's the radial nerve. Perfect, hai bachcho? Okay, now can anyone tell me, let me clear this, let me clear this. Can anyone tell me who's this? ये कौन है? ये muscle कौन है? What is this muscle? Students, this is a muscle which lies in the floor of the cubital fossa. Answer that. Muscle which lies in the floor of the cubital fossa. In other words, what am I asking you? Which are the muscles forming the floor of cubital fossa? Come on. Muscles forming the floor of cubital fossa. Anyone? Muscle है वो, muscle है बच्चा, muscle है. I'm asking the muscle. Anyone? बोलो बच्चों, बोलो, आंसर करो. Which are the muscles which forms the floor of cubital fossa? दो muscle होते हैं. There are two muscles which form the floor of cubital fossa. एक होता है supinator and दूसरा is brachialis. Brachialis and supinator. So supinator is on the lateral side. This is supinator. And brachialis is on the medial side. Brachialis दिखता नहीं है. What is this muscle? That's the pronator teres. This muscle is pronator teres. Okay. Brachialis है ना man. What is this nerve? This is the median nerve. And what is this nerve? That's a ulnar nerve. है ना? Median nerve and ulnar nerve. तो जितना भी अपन identify कर सकते हो, I'm trying to identify. I'm trying to make you identify this. So be very clear about this visual slides. Visual slides are very important. Is this clear, bachcho? Is this clear? What is the musculocutaneous nerve ka root value? Can you tell me? Root value? Musculocutaneous nerve is a branch of which cord? Lateral cord. What is the root value of musculocutaneous nerve? C5, C6 and C7. And what is the musculocutaneous nerve supply? It supplies the biceps, it supplies the brachialis, and it supplies the coracobrachialis. Biceps, brachialis and coracobrachialis. I hope this is clear to all of you. Okay. Fine. So we'll go to the next MCQ. Here we go. This is a very important MCQ. Very important MCQ. A 45 years old patient presents to the clinic with complaints of recurrent burning pain in the upper abdomen, particularly after meals at night. The person describes the pain as relieved by antacids. An upper GIT endoscopy is performed revealing an ulcer in the mucosa of GIT. Which artery is often at the risk of erosion and lead to life-threatening bleeding? Answer this. Superior mesenteric nahi hai bachcha. It's not superior mesenteric, no. Answer is gastroduodenal artery. Answer is gastroduodenal artery. So now you tell me, where is the ulcer? Which part of GIT is the ulcer? बोल सकते हो? Which part of GIT is the ulcer? Very good, bachcha, very good. Excellent. So which part of GIT is the ulcer located? Or in other words, ये जो gastroduodenal artery है, it is related to which organ? Yes. Come on. You're all answering very well. Come on, you can do it. You can answer this. Which is that part of GIT? Gastroduodenal artery barabar hai bachcha. I'm asking you in some other way. See, I want you to be an all-rounder. ऐसे नहीं कि one direction में you will be able to answer. No, the same question can be put in n number of ways. And I want my children to be 360-degree view. Yes, answer is duodenum. Very good, duodenum. So, where's the ulcer? Duodenum. Which wall of the duodenum? अभी specific बोलते थे ना बच्चा. You could have told me the posterior wall of the first part of duodenum. Ulcer is in the posterior wall of the first part of duodenum. Yes. Clear? Okay. So that is gastroduodenal artery. Fine. So celiac trunk, what is the vertebral level? T12. Celiac trunk, the vertebral level of origin is T12, and what does it supply? Foregut. It supplies the foregut. Celiac trunk supplies the foregut, right? Superior mesenteric artery, what is the vertebral level? Can anyone tell me what is the vertebral level of superior mesenteric artery, bacha? Anyone? Vertebral level of superior mesenteric artery. L1 है बच्चा, L1. Vertebral level of superior mesenteric artery is L1. Remember, it's L1. L1. And what is the superior mesenteric artery supply? It supplies the midgut. And what is the vertebral level of inferior mesenteric artery? Inferior mesenteric artery is L3. And what does it supply? It supplies the hindgut. ठीक है? So celiac trunk vertebral level, ये vertebral level याद रखना है. Vertebral level are very important. Okay, celiac trunk is T12, supplies the foregut. Superior mesenteric vertebral level is L1, supplies the midgut, and inferior mesenteric artery vertebral level is L3, supplies the hindgut. Perfect है बच्चा? Can anyone tell me the branches of splenic artery? Splenic artery के branches. Can anyone tell me the branches of splenic artery? Look, what is this? That's the duodenum. What is this? Pancreas. What is this? Spleen. What is this? Artery here. What is this? Artery here. Splenic artery. What are the branches of splenic artery? One to the pancreas. What are these? Pancreatic branches. It gives branches to supply the fundus of the stomach, which is the organ here like this. The organ here like this. That's a fundus. So what are these branches which supply the fundus? Short gastric, short gastric branches. And there's a branch which goes along the greater curvature of the stomach. Can anyone tell me this branch? Anyone? Number 3. These are pancreatic branches. I'll put number 1. These are the pancreatic branches. Number 2 are the short gastric branches. And what is number 3? Anyone? Akhand, what is that? Yes, बच्चा बोलता हूँ. It is the left gastroepiploid. Left gastroepiploid artery. ठीक है? Splenic artery is very tortuous, and splenic artery is a branch of celiac trunk. ठीक है? Everything is clear, बच्चा? ये याद रखना. Always keep this in mind. Ulcers are very common in the posterior wall of the first part of duodenum, and the artery which is lying behind the first part of the duodenum is gastroduodenal artery. ये concept है बच्चा. This is the concept. On this concept, MCQs can be framed in any different way. Any clinical MCQ you can get on this. But concept क्या है? Gastroduodenal artery lying posterior to the first part of duodenum. That's it. बस ये याद रखना. Perfect. I hope I'm clear to all of you, बच्चों. We'll proceed. थोड़ा सा fast, huh? Here we go. In a patient presenting with acute abdominal pain and a suspected ovarian condition, the surgeon identifies a structure in the ovarian fossa. Very important, bacha. Very important. Ovarian fossa. Which wall of the ovarian fossa would the ureter typically be located? बोल सकते हो? Ovarian fossa. Anyone? Posterior. Yes, Kshitij. Very good. Akhand, it's a posterior wall of the ovarian fossa. Let us understand the boundaries of ovarian fossa. Okay, I'll just make it here for you first. पहले यहाँ पे draw करता हूँ. एक मिनट. तो लोग कैसे याद रखते हैं? A very easy way to remember the ovarian fossa. This is an artery here. This is an artery here going like this. So this is our external iliac. What is this, bachon? This is the internal iliac. And what is this structure which goes along with the internal iliac? Internal iliac artery के साथ it goes. What is this structure? Ureter. That's a ureter. And what is this structure which goes like this? this is our ovary. ये क्या है? Can anyone tell me what is this that I've drawn? What is this that I've drawn? ये nerve है, artery है. Which nerve and which artery is related laterally to the ovary? Or what structure forms the lateral wall of ovarian fossa? This area is the ovarian fossa. ठीक है बच्चा? So superior boundary of ovarian fossa is formed by external iliac vessels. The posterior boundary of ovarian fossa is formed by the internal iliac and the ureter. And laterally and the floor, water under the bridge नहीं है बच्चा. नमन, water under the bridge is that uterine artery. Water under the bridge अलग है बच्चों. वो है ना वो. This is uterine artery. And वो क्या था? Ureter. Uterine artery going over the ureter, that is water under the bridge. नमन, हाँ ठीक है ना? So ureter, when it goes now, the uterine artery goes over the ureter, that is water under the bridge. ये याद रखना. This is obturator, nerve and vessels. Obturator, nerve and vessels. So what is this? Lateral. Laterally and the floor. Laterally and the floor कौन है? Obturator, nerve and vessels. External iliac is superior. Superior boundary of ovarian fossa is formed by external iliac. ये दो क्या बनाते हैं? They form the posterior boundary of ovarian fossa. Clear है? So this area is the ovarian fossa. I hope I'm clear to all of you. Look at this slide. Look बच्चों, this is the ovary. This is the ovary and this area is the ovarian fossa. So what are the boundaries of ovarian fossa here? Who's this? That's the external iliac. What is this? They have cut this. This is the internal iliac. And what is this structure? Ureter. And then you laterally, it is not seen, but laterally would be the obturator, nerve and vessels. You can take this also as lateral, that's fine. समझ में आ रहा है बच्चों? Is this clear? Are you all enjoying? Are you all understanding बच्चा? Are you all enjoying? एक मिनट, I'll just type for you. Fine till here? Okay. Can anyone tell me what is this pouch? What is this? What is this pouch? जो दिख रहा है, I'm asking you. Whatever is seen, I'm asking you. What is this pouch now? Answer बच्चों. Come on, come on, come on. It's a pouch between the rectum and the uterus. What's that? Okay. It's between the rectum and the uterus. The peritoneum comes to the rectum and the peritoneum goes to the uterus. What is that pouch known as? The pouch of Douglas. Excellent. Very good. Pouch of Douglas or the recto-uterine pouch. ये याद रखना बच्चों, this recto-uterine pouch is the most dependent part of the body in standing position. So when we stand up, if there's any fluid in the body, it goes down into the recto-uterine pouch. Fine. And which is the most dependent part of the body in supine position? बोल सकते हो? Another MCQ for you. If we lie supine, जो भी fluid है, fluid in the peritoneal cavity will go to which pouch? Answer that. Answer, answer, answer. Fluid in the peritoneal cavity when we lie supine will go into subhepatic. Any better name for that, bacha? Any better name, Naman? It is known as the Morrison's pouch. It is known as the hepatorenal pouch of Morrison. ये याद रखना बच्चों. So when we lie supine, the most dependent, समझते हो, the most dependent part of the body in supine position is Morrison's pouch. And when we stand up in females, the most dependent part is recto-uterine pouch. That's a pouch of Douglas. In males क्या होगा? Recto-vesical pouch है ना, uterus नहीं है तो recto-vesical pouch. Perfect है. It is known as Morrison's pouch. Okay, perfect. In supine position. Chalo, we'll go to the next MCQ. Yeah, answer this, bachcho. The ureters appear hazy in appearance, being a retroperitoneal structure. मतलब all the retroperitoneal, yes, very good, Shafina, very good, bacha, very good. So all the structures which are behind the peritoneum are retroperitoneal structures, and they look hazy. मतलब ऐसे clear नहीं दिखते. They don't look clear. They look hazy, hazy, hazy because they are retroperitoneal. Dissection of ureters is difficult as it is crossed by numerous structures and is liable to injury. Which of the following structures does not pass anteriorly over the right ureter? Yes, Shitish. Very good. Very good. Very good. Akhand, it's the genitofemoral nerve. Where is genitofemoral nerve with respect to ureter? बोल सकते हो? Huh? Is the genitofemoral nerve related to ureter first of all? बोल सकते हो? Is the genitofemoral nerve related to the ureter? Genitofemoral nerve lateral side. No, it's posterior. पीछे होता है ये. Genitofemoral nerve is behind the ureter. So posterior relation of ureter क्या होगा? एक होगा genitofemoral nerve, दूसरा होता है psoas major. Look at that. That's beautiful. That's beautiful. So what is this muscle, बच्चा? This is the psoas major. That's the psoas major, and psoas major के पीछे कौन है? Genitofemoral nerve. Psoas major के ऊपर, I'm so sorry. Who lies on the psoas major? Genitofemoral nerve. And what is this structure? That's the ureter. That's the ureter. Genitofemoral nerve is related to the ureter posteriorly. Or the ureter is lying on the genitofemoral nerve. ये याद रखना. And because genitofemoral nerve is lying on what? Psoas major. And genitofemoral nerve is lying on the psoas major. What is this structure? Which is crossing the ureter. ये बोल सकते हो, what is this structure crossing the ureter? This structure crossing the ureter is gonadal vessels. ये है gonadal vessels. हाँ, ठीक है ना अखंड? Okay, that's gonadal vessels. शैल कुमारी, fine. Kshitij, fine. Okay. Now, what are the structures crossing the ureter? One moment, I'll show you this. Look at this. I'll just make this enlarged. बहुत important है ये बच्चों, बहुत important है. Can you identify this? Can you see this? You can see this structure, hazy structure. देख रहे हो? This hazy structure is the ureter. And why is it looking hazy? Because it is retroperitoneal. है ना? It is retroperitoneal. So what are the structures which cross the ureter? I'll just put numbers here for you. This is number 1. Number 1. This is number 2. This is number 3. This is number 4. And this is number 5. Can anyone tell me what is 1? Number 1. Structures crossing the right ureter. Number 1 is third part of duodenum. Number 2. Right colic artery. Number 3. Ileocolic artery. Number 4. Root of mesentery. Number 5. Gonadal artery. Number 5 is gonadal artery. Perfect है ये बच्चा. The structures crossing the right ureter, anterior relations. ये बहुत important है बच्चा, बहुत important है. This is always asked in the MCQs. Remember this. So number 1 is the third part of duodenum. Number 2 is the right colic vessels. Number 3 is the ileocolic vessels. Number 4 is the root of mesentery. And number 5 are the gonadal vessels. Perfect. Okay, I'll proceed then. So what is the answer for this MCQ? And ileum bhi aata hai. Ileum is also there. What crosses the right ureter? They have not drawn here, but one structure is the ileum also. 6 is ureter. 6 is ileum. Ileum. They have not shown here. So what is the answer here? The 6 is ileum. 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 6 is ileum Does vas deferens cross the ureter? Yes, vas deferens also crosses the ureter in the pelvis. In the pelvis. Okay. So these two structures are going to cross the ureter in the abdomen. The vas deferens is going to cross the ureter in the pelvis. I'm showing you this. I'm showing you this. Look at this. Look at this. Beautiful, beautiful. Who's this? Who's this? That's a ureter. That's a ureter. And ye kaun hai? Ye kaun hai? That's a vas deferens. Can you see this? Can you appreciate this? So who's going to cross the ureter in males? The vas deferens. And this is one of the constrictions of the ureter. है ना? एक constriction क्या होता है? Crossing by the vas deferens in males. बच्चों समझ में आ रही है? Is this clear? Are you all able to follow this? Difficult है? कुछ difficult लगता है तो you tell me. Difficult है तो बोलो. हाँ? You tell me if you're finding it difficult. Fine. Perfect. Chalo, answer this. Another very important MCQ, children. Very, very important MCQ. A 19-year-old female came to your clinic with complaints of not having menses even once. So that is primary amenorrhea, right? Primary amenorrhea. You notice that she has normal secondary sexual development and order for an ultrasound. It reveals that there is absence of uterus and the upper part of vagina is absent. So uterus is absent, upper part of vagina is absent, the lower 2/3 of vagina is still present. You begin to consider FMGE syndrome and explain to the patient that the lower part of the vagina is present since it develops from the rest from one of the following. Sino-vaginal bulbs. Okay, very good. Constrictions बोलता हूँ बच्चा. Constrictions I'll tell you. Constrictions of ureter बोलता हूँ. एक मिनट. So, tell me, the fundus, body, cervix, fallopian tubes, and upper 1/3 of the vagina is derived from. Answer this. All this is derived from what? Paramesonephric duct. All this is derived from paramesonephric duct, also known as the Mullerian duct. Paramesonephric duct or the Mullerian duct. The lower 2/3 of the vagina is derived from sino-vaginal bulbs. Mesonephric nahi hai bacha, Naman, it's paramesonephric duct. The lower 2/3 of the vagina is endodermal. Endodermal in origin. Whereas the upper 2/3 of the vagina is derived from what? Yes? Lower 2/3 of the vagina is endodermal in origin, whereas the upper 1/3 of the vagina is mesodermal in origin, right? It is mesodermal in origin. Perfect? Okay. So this is derived from the paramesonephric duct and this is derived from sino-vaginal bulbs. Okay, fine. Can anyone tell me the constrictions of ureter? Constrictions बोल सकते हो? Constrictions of ureter बोल सकते हो? Anyone? Okay, there was some problem. Constrictions of ureter, can anyone tell me? Hello, बच्चों, come on. Constrictions of ureter. So this one is, चलो बोलो, constrictions of ureter. One is pelvic-ureteric junction. Our Naman wants constriction of ureter. So one is pelvic-ureteric junction. Second is crossing of pelvic brim. Crossing of pelvic brim. Third, crossing by vas deferens. ये vas deferens males में, crossing by vas deferens in males, or in females it would be entry in broad ligament. ठीक है? हाँ, yes. Fourth is entry into bladder, entry into trigone. See, surgically है ना 5 constrictions है. Anatomically there are only 3 constrictions. Anatomical constrictions कितने हैं? Pelvic junction, crossing of the pelvic brim, entry into the bladder. These are 3 normal anatomical constrictions. But surgically there are 2 more. One is crossing by the vas deferens or entry into the broad ligament and entry into the trigone. So total we take 5 constrictions of the ureters. ठीक है बच्चा? 5 constrictions of the ureters. Okay, chalo. We'll go to the next slide. We'll go to the next MCQ. Answer this. The terminal part of IVC, also known as hepatocardiac channel, is primarily derived from which venous structure during embryonic development? Can anyone tell me? It's thoda sa difficult hai. This is a difficult MCQ. Anyone? Anyone? Difficult hai ye. The terminal part of IVC, also known as hepatocardiac channel, is derived from which venous structure during embryonic development? It is the right vitelline vein. It's the right vitelline vein. Right vitelline vein. I'll tell you this. Thoda sa difficult hai ye. Now, you know, there are 4 chambers of the heart. ये ना ऐसे 4 chambers होते हैं of the heart. What is this chamber known as? This chamber. This is the truncus arteriosus. This is the ventricles. This is the atria. And what is this known as? Sinus venosus. Sinus venosus. दो होते हैं. This is the left horn and that's the right horn and this is the left horn of sinus venosus. ठीक है? In this sinus venosus, there are 3 veins which open. Look. There are 3 veins which opens into the sinus venosus. This you should know, huh, bacha? Yeah, this you should know. Yes, embryology. This is the fetal heart. This is the fetal heart. So there are 3 veins which opens in the sinus venosus. One is vitelline. Second is umbilical, and third is common cardinal. 1, 2, 3. So there are 3 veins which opens in the sinus venosus. This also comes as an MCQ. ये भी MCQ है. So there are 3 veins which opens in the sinus venosus. One is the vitelline vein, second one is the umbilical vein, and the third one is common cardinal vein. Common cardinal vein. Perfect है? So, ठीक है बच्चों? Now, this vitelline vein, just try to understand this. ये जो vitelline vein है ना, थोड़ा difficult है ये. Just try to understand this. Vitelline vein begins from where? Yolk sac. Yolk sac से begin होता है. Vitelline vein begins from the yolk sac. This is one vitelline vein on this side. This is one vitelline vein on this side, and as this vitelline vein are going towards the sinus venosus, ये कौन है? Sinus venosus है ना? So vitelline vein begin from where? Yolk sac, and this vitelline veins are going towards what? Heart. They're going towards the heart. They're going towards the sinus venosus, and as they're going towards the sinus venosus, look, bacha, as they're going up towards the sinus venosus, on the way comes the liver. I'm telling you in a very easy way. Look. बीच में कौन आ गया? ये लीवर आ गया. लीवर. हाँ. अब this vitelline veins will go through the liver, and in the liver they break down. They break down in the liver. देखो बच्चों, they have broken down into the liver, and what do they form here? They break down into the liver and they form the hepatic sinusoids. Hepatic sinusoids पता है आपको? Hepatocytes है ना, hepatocytes, and between the hepatocyte दो spaces है ना, उसको क्या बोलते हैं? What do you call this as? Hepatic sinusoids. So hepatic sinusoids are derived from vitelline veins. Of these 2 vitelline veins, there are 3 connections here. There are 3 connections in this 2 vitelline veins, and there are 2 veins which comes in joints here. One is the superior mesenteric vein and the other one is the splenic vein. Splenic vein and superior mesenteric vein comes and joins here. Now this part of the vitelline vein, बच्चों मेरे प्यारे बच्चों, this part of the vitelline vein, what is it going to form? Can anyone tell me this? Can anyone tell me this? What is this? ये क्या बन गया? ये कौन है? Who's this? What is this that I've drawn in green? Hello, hello, मेरे बच्चों, बोलो 329. Answer. What is this in green that I've drawn? Huh? Guess. IVC नहीं है बच्चा, ये IVC नहीं है. ये ऐसे किधर है IVC? No, this is not azygous vein. ठीक है, very nice, good. You guess. One more chance I'll give you. One more chance. अरे बच्चा देखो ना, ये स्प्लेनिक वेन है, ये सुपीरियर मेसेंट्रिक वेन है. Splenic vein and superior mesenteric vein joins to form what? Splenic vein and superior mesenteric vein joins to form what? नहीं, you can't guess. एक मिनट. Portal vein है ना बच्चा, portal vein है. ये pancreas है ना बच्चा, this is the pancreas ना. So there's a vein coming. ये देखो, there's a vein coming like this and there's a vein coming like this, and what is this vein? That's the portal vein. तो ये जो green मैंने draw किया ना, this green that I've drawn is the portal vein. This is the portal vein. So what I'm wanting you to understand is, what do the vitelline vein form, बच्चों? Vitelline vein forms, number one is the portal vein, number two are the hepatic sinusoids, and now this part of sinus venosus obliterates off. The left horn of sinus venosus goes off. It goes off, है ना? So this is gone. And this part of the right vitelline vein, this is the right vitelline vein. This is known as the hepatocardiac channel. This is the hepatocardiac channel, and what is this going to form? The terminal part of IVC. That forms the terminal part of IVC. So terminal part of IVC is derived from the right vitelline vein. This is what I want you to understand. समझ में आई है? So what is a vitelline vein form? Vitelline vein एक begin कहाँ से होता है? Yolk sac. And where are they going to? The heart. बीच में liver आता है, बीच में liver आ गया. So it gets broken down into the liver. It forms the hepatic sinusoids. The left vitelline vein disappears off. The right vitelline vein forms the hepatocardiac channel, which is going to form the IVC. Plus the vitelline vein also forms the portal vein. Hey, hello बच्चों, is this clear to all of you? समझ में आ रहा है? So this in a very easy way I'm telling you, बहुत easy way I'm telling you. Understood? That's it. Perfect. Okay. So how is the IVC form? बस ये इतना. How is the IVC form? Look, I'll just label this for you. This is the posterior cardinal vein. अभी है ना? I'll just label in short. I'll tell you. What is this? I'll put numbers here, Janito. This is number 1. This is number 2. This is number 3. This is number 4. This is number 5. The IVC is derived from, 1 is posterior cardinal vein. Second is, एक मिनट, supracardinal vein. Third, supra subcardinal. anastomosis, subcardinal vein, hepatocardiac channel. That's the formation of IVC. ये देखो, I'll just label this number 1, this number 2, this number 3, this number 4, and that's number 5. So one is posterior cardinal vein, second is supracardinal vein, third is supra-subcardinal anastomosis, fourth is subcardinal vein, and the fifth is the hepatocardiac channel. Fifth is the hepatocardiac channel. So बस ये याद रखना, the terminal part of IVC is known as the hepatocardiac channel, which is derived from the right vitelline vein. Derived from the right vitelline vein. ठीक है, थोड़ा difficult है ये. This was a difficult MCQ. Yeah, perfect. So I've told you the derivatives of vitelline vein. I've told you how the IVC is formed. Clear? So hepatocardiac channel है ना, it is derived from right vitelline vein. I hope this is clear. Clear है बच्चों? Hello, is this clear? एक बार go through कर लो बाद में, हाँ, just go through it later, and that is okay. You get to learn many things. देखो test and discussion कैसा है ना, it is, you get to know many new things in this test and discussion. That's okay, that's no problem. Have a look at this. A 44-year-old man comes to the hospital with abdominal pain, jaundice, loss of appetite, and weight loss. On examination, his radiographic and CT scan, a physician finds a slowly growing tumor in the unsnake process of pancreas. Which of the following structures is most likely to be compressed by this tumor? What is the answer? So out of these 4 structures, who's related to the uncinate process of pancreas? हाँ, बोलो ना बच्चों. Naman. Answer is superior mesenteric artery. Superior mesenteric artery. Look at the slide. Look at the slide. So what is this? What is this part of the pancreas? That's the head of the pancreas. That's the neck of the pancreas. That's the body of the pancreas. That's the tail of the pancreas. That's a head, that's a neck, that's a body, that's a tail. And what is this process? Uncinate process. है ना बच्चा, uncinate process. So who is this lying on the uncinate process? On the uncinate process lies the superior mesenteric vessels, superior mesenteric artery and the vein. So if there's a tumor of the uncinate process of pancreas, this tumor will grow over the superior mesenteric vessels. The tumor will enclose the superior mesenteric vessels, and the tumor is going to compress what? The superior mesenteric vessels, because the superior mesenteric vessels lies on the uncinate process. Clear, Naman? Bacha, clear? So answer is superior mesenteric artery. Answer is superior mesenteric artery. So portal vein is derived from what? Vitelline vein. Okay, now portal vein is formed from the vitelline vein. Superior pancreaticoduodenal artery is a branch of what? Anyone? Superior pancreaticoduodenal. Naman, clear hai na bacha? Is this clear to all of you? Yes. Superior pancreaticoduodenal artery is a branch of what? Anyone? Superior pancreaticoduodenal artery is a branch of gastroduodenal artery. Gastroduodenal artery, which is a branch of common hepatic artery. देखो, arteries are very important. The blood vessels are very important. Celiac trunk, superior mesenteric artery, inferior mesenteric artery, उनके branches you have to know. Which is a branch of celiac trunk. That is finally a branch of celiac trunk, but उसके sub branches you have to know. Okay, perfect.